Mr. President, reserving the right to object.
Recognize the senator from Idaho.
Thank you, Mr. President. One thing needs to be made really clear. We have all this talk about how we have an urgent crisis, and it can be totally fixed if we just accept the demand of my colleagues on the other side that we extend the temporary COVID health care premium enhancement that occurred during the COVID crisis. This is what needs to be made clear. Insurance premiums are skyrocketing, not because of a temporary small COVID premium support passed during the COVID crisis. They are cratering, they are skyrocketing because our healthcare system is broken and needs to be fixed. And we've been asking to negotiate about this for years and intensely over the last few months. And let me give it some real specifics. This demand that my colleagues on the Democrat side are making, even if it were true that it was all of it was an impact, letting it expire would be an impact on premium increases, which is not accurate. Even if all of it were to be impacting premium increases, it's only 4% of the premium support. It's only 4% of the premium increases that are coming. So we have the entire United States government shut down because we won't concede to a demand that we spend another $100 to $350 billion in premium supports because the premium expansions are coming, resulting from a broken healthcare system that we can get no engagement on in negotiating. Congress has a timely, bipartisan obligation to reopen the government. The proposal offered by my colleague on the other side of the aisle does not address that. The Senate has now voted 14 times to end this shutdown. My Democrat colleagues claim to be taking a stand to make health care more affordable. While we may disagree on the merits of those individual policies, everyone in this chamber shares that goal. In fact, as a part of the clean CR that we have voted on 14 times to extend critical Medicare and Medicaid programs, we would have increased payments to rural hospitals. We would have provided access to telehealth services for our seniors. We would have offered our seniors the option to receive hospital-level services in their homes. But no, not unless we agree to spend $350 billion or $100 billion. The current request is around $100 billion. Not unless we agree to spend billions of dollars extending what were made temporary by my Democrat colleagues when they controlled the Senate. They were made temporary because they were intended to get us through the economic difficulties of the COVID crisis. And again, they relate to only 4% of the premium increase that is coming. And yet it is said that we can solve the entire premium increase problem today by just doing this. Not true. Because Democrats will not join Republicans in reopening the government, these programs that I mentioned just a moment ago have lapsed. These programs have lapsed, disrupting care for millions of Americans. Premiums are going up dramatically for all Americans, and not just those enrolled in Obamacare. And despite the confusion that has been created here, the original Obamacare subsidies don't expire. Let's make that very clear. The only thing expiring is temporary COVID-related enhancements that the Democrats themselves made temporary. The Democrats are the ones who set the expiration date that we're debating today. Even without extending these COVID enhancements, Taxpayers will spend $1 trillion over the next 10 years subsidizing Obamacare premiums. So let's not tell the American people that the American government is going to stop subsidizing the failed Obamacare premium system. Over $1 trillion is going to be spent subsidizing it. We need to address that problem. We cannot spend our way out of rising premiums. If my colleagues want to have a conversation about reforms that truly lower costs, instead of masking the problems with a $100 to $350 billion taxpayer-funded patch, then Republicans are willing to have that conversation. Leader Thune has made this point clear. In his own words, he said, "I am willing to sit down with the Democrats," and I join him. I'm also willing to sit down with the Democrats to discuss the growing unaffordability and unsustainability of Obamacare. It's a system they created, but I'm happy to hear them out. I'm still quoting Leader Thune. Heck, I'm even willing to give them a vote, which we have offered and offered and offered. But there's one condition: end the Schumer shutdown. I will not negotiate under hostage conditions, nor will I pay a ransom, period. That's the end of the quote from our leader, Leader Thune. For these reasons, I object to my colleague's request.